A small introduction about Dr. Sreekanth. Dr. Sreekanth graduated out of Stanley Medical College, Chennai. He was an hardcore Chennaiite for almost about 25 years from his birth. Then he went on to do his master's, and then he was in Hyderabad, Bangalore, then some time in the United States, and then now he is settled in Singapore. He is a specialist in neonatal treatments, meaning he takes care of just born and below, say, 3 or 6 months old babies. Plus, he's most sought after consultant for various other faculties in Singapore and in the US. We should thank Dr. Sreekanth for accepting our invitation to address us today. Thank you, Dr. Sreekanth, and over to you.
Okay, thanks, SL, for that kind introduction as well as invitation. And I also wanted to thank Mr. Jayakumar for helping out in this webinar, or a short 1 hour introduction or foundation to COVID. Interestingly, I want to actually congratulate all of you who are actually involved in this meeting, because it's a very important aspect of information dissemination. As far as COVID goes, there has been a lot of damage done already, but that doesn't mean that we're not going to see more of it. And in fact, we'll be seeing more of it. And there is a saying that say, forewarned is forearmed. And that means that the more you know about it, the more you take care of it yourself, the better it will be for all the people at large, as well as the family and the children who are going to be more susceptible to this COVID infection in the next time around. And interestingly, people talk about second wave, third wave, fourth wave. You can have any number of those. There is no limit to those. It all depends on how it keeps circulating and coming back. And we have a specific responsibility as individuals to be able to stop it and put a stop to where it is. Think of it like a bad WhatsApp message or a bad WhatsApp video that keeps coming back. And we are the ones who have to stop it from getting recirculated. And with that introduction, I would like to just proceed with this presentation. And certainly, I would encourage all of you to ask your questions as and when you think about it, but really, please post it in the question and answer session or in the chat box, not in the chat box, because they will be able to screen it and get it answered in the end of the talk. Now, the topic itself is kind of interesting, what Mr. Jayakumar gave me, and he said, spare away from COVID. And, I keep thinking for a while, yes, I'm not able to move the slide. I don't know why. Let me see.
You're not able to move the slide?
Yeah, hang on. Let me see, because it should be, okay. Yeah, here you go. I'm actually doing the PowerPoint.
No, I think the transition time is more.
It's probably. So anyway, I just went ahead looking for the reason why Mr. Jayakumar would have asked that title as a spare away from COVID. And this is not going to be an extended English tutorial by any means, but certainly something to think about. When you use spare as a verb, you can see that it can mean many things, one of which the usage is to not hurt or destroy something or someone. Spare can also mean to prevent someone from having an unpleasant experience. Spare can also be spare no effort or expense, in that try as hard as you can to achieve something. Spare can also mean to give time, money, space, and especially when it is difficult for somebody to be able to carve out that space and time for somebody, such as spare a thought, to think about someone who's in a difficult or unpleasant situation. Now, if you think about it, all of this applies to COVID. And it is very interesting that he chose those words, But I want you to think about it because every bit of this is what all of us are going through. And we need to actually make sure that we're able to spare a thought for someone who's in distress, spare some time for somebody who has got a difficulty or a difficult time dealing with COVID. Also, try not to spare any expense to treat COVID and to prevent COVID from spreading, and also making sure that we do our part. Now, with that, the agenda for this particular talk is going to be basically how do we prevent, first of all, from getting COVID? In the medical terminology, we call that as primary prevention. How do we even prevent somebody getting infected with COVID? The second part is if you get infected, there are different stages you go through. What we would call as a mild disease, maybe for some in between a moderate disease, and of course, severe, you have to be hospitalized. And it can result in mortality, that is death. And secondary prevention is after you get the infection. And that's the second part of my talk. The third part is going to be focused specifically on vaccination as a form of both primary and secondary prevention. And last but not the least, I'll be more than happy to answer your questions. Now for the first part of my talk, I've broken it down to these 3-4 parts, and we will hope to spend some time in making you guys understand what COVID is all about and what is this virus and what can we do to, first of all, prevent it from coming to us. As you can see, it's a very simple structure when compared to some of the other cellular biological mechanisms as well as cellular biology that we're used to, something in the animal kingdom, human physiology. This is fairly simple. It has got an outer coat that has got certain types of proteins, which has to be there in order for the membrane to be secure and prevent the nucleic acid, which is inside, to leach out. And if it leaches out, it's not going to live. So basically, this membrane is a protective layer, and you got one simple compact nucleic acid that actually works towards help in multiplication of the virus. So it's a very simple construct, 2-layer construct, if you will. But the membrane itself has got different variations of the theme. And as you can see in this photograph or cartoon, you've got something called the spike glycoprotein. We'll come back to it in a little bit later when we talk about vaccines. It's very important. We've got a membrane protein, we've got an envelope protein, and we've got a bunch of other things, including the nucleic acid and the viral RNA that is basically helpful in multiplication of this virus. So one to protect the virus, one to help the virus to multiply. Now that brings us to a very important part of it. Now that we said it's a very simple thing, sometimes the most damage or the most rapid multiplication can happen when the cellular mechanisms are very simple, because it doesn't have to deal with a whole lot of issues from different quarters. You will come back to it in a little bit, why countries which are very small, very compact, have done very well with controlling the COVID pandemic, while countries such as ours or the United States, which has huge number of population, say 1.5 billion, has not done very well. And that is basically related to the fact that even the viruses in the animal kingdom and the cellular mechanisms works in a similar fashion. The bigger and more complex they are, the more difficult it is to control. So coming back to the transmission, most commonly, I'm not going to go back to the politics as well as the previous theories about how it had jumped from the animals or birds. In this case, people were thinking about bats because the previous virus that is called the SARS virus or the MERS virus, which is the Middle Eastern respiratory virus, they all belong to the same coronavirus family. But the SARS virus and the MERS virus, which has sort of died down now, has been creating havoc a few years ago in most of the Middle Eastern as well as the Oriental countries. Now, they also belong to the coronavirus, but they behaved a little bit differently. Their structure was a little bit different than the current COVID virus. This one transmits once the human beings have been penetrated from the animal, whichever that might be, then it is able to spread from one animal to animal, from one human being to another human being. It can be either in the form of direct transmission from one person to another person while they're talking, or sneezing or coughing. It can be a droplet. It can be through fecal oral route, meaning if your hand hygiene is less than adequate, we'll come back to regarding why we keep harping about hand hygiene and not rubbing the hands on the face or the nose, which I just did. It is important for you to understand these are the ways how it gets transmitted, and preventing these will be primary prevention. The reproductive rate, which is interesting because this is the multiplication rate of this particular virus, has been termed on the lab front as being about 2.24 to 3.58. And what it basically means is for every time it multiplies, it is able to get to 4 human beings. It is able to transmit itself to 4 human beings. So you can do the mathematics. And as if you have 1,000 people exposed who are carrying this virus, and each one sends to 4, and 4 sends to another 4, you keep multiplying that way. So that is the reason this has got very good transmission characteristics and is able to get from one human being to another human being. Now, people have talked about quite a bit, and there is a lot of misinformation that's going around. I hope I can actually settle some of those with this particular slide. First of all, the new variant that we're talking about, it has gone through multiple mutations. When we say variant in a virus, what it means is the protein on the membrane basically changes its form and its structure, with sometimes with the nucleic acids, sometimes with some of the other constructs inside the protein itself. These are basically proteins, and it's in the end of the protein structure, you have nitrogen and carbon. So some of those can actually be altered in ways that it can present itself in a different format. And when it does, you call it as a variant. Now, basically, this has changed many times since the original virus that started sometime in Wuhan, China. Last December, it started. And then since then, it has changed quite a bit because it keeps multiplying. And each time it multiplies and goes from one person to another person, it can change. Some of these changes are very minor, so it may not be actually mutation. When you have a profound change, we call that as a mutation. And it can actually become a separate variant in and of itself, carrying different characteristics. Sort of something like a human evolution. We always talk about it as people who have taken millions of years from chimpanzee to become a human being. But this only takes a few days to months in order to become a different variant in and of itself. The most recent variant that we're talking about and worried about, which has been currently renamed from WHO as being a Delta variant, but previously named as B1617, has been identified first in the UK. And since then, it has come to India, and it has really created a big problem during the second wave. The first wave in and of itself, the first time when we got it, we were able to get it in control, probably because it was not a very successful transmission process. And we were able to get on top of it rather quickly. However, because of its different transmission property, the question, is this variant severe than the previous variants? Of course, yes, if you talk about transmission. But if you talk about severity as the way it actually affects the human body, as well as elicits the ultimate outcomes with regards to death or with regards to lung damage or other damages, this has not been proven to be any different than the previous ones. So that's a good part of it. The bad part of it is it can actually spread very fast. So once again, the spreading and the transmission that we need to be observant and be careful about how we control that is going to, in effect, convert itself into a final tangible outcome of decreasing the severity and decreasing the mortality. Now, a little bit about the COVID mutations, which I had alluded a little bit before. Like I said before, there are many types of coronaviruses. This and the SARS family also belong to coronavirus. In fact, coronavirus has been around for quite a bit time, and not all coronaviruses are same. And this is like saying human beings are same. And this is akin to that because it's as foolhardy when you actually compare one to other. It is also, the current one is known to have several mutations, not just 2 mutations, because people have been making a big hype about whether it is a triple mutant, double mutant. It doesn't really matter. But the point is, what can it do is all it matters. And in this particular case, it can actually very effectively transmit from one person to another person. So a little bit about the background, which I just gave you. This is something that is not new to you, but I think it's very, very important that I impress and we have a good foundation on this before we actually move on to the rest of the slides. How to stop COVID-19? The best way, of course, is to prevent it. I just told you that. So there are different layers. Think of yourself, if you want to protect yourself from cold, you want to wear an inner layer, then maybe a shirt, maybe a sweater on top of it, and then another jacket on top of it. This is very something that people who live in cold climate will be able to understand. On the other hand, if you want to protect yourself from anything that is bad, be it radiation, for example, people do x-rays in hospitals, there are multiple layers of lead that is being put in, including on the human being, on the patient that is undergoing an x-ray. And this is something like that. So if you really want to prevent yourself from the coronavirus, have as many lead layers between you and the coronavirus. The first easy thing to do is to avoid big gatherings. Keep social distancing. Stay away from people. Stay away from contact, even if you want to meet people. So it's extremely important that you avoid anything that is majorly crowded, i.e. malls, sometimes religious meetings or gatherings. Social distance becomes the next barrier. And even if you have to go, for example, weddings, funerals, whatever it is, try to stay as far away from the next person as possible. At least a 6-foot separation or 2 meters is what is considered to be adequate. Make sure that if you have to get close to something or somebody, that you wear a mask at all times. And the mask is very important. We will go through it a little bit because people use masks in different ways. Some above the nose, some below the nose, some on the head. And all those are as funny as it looks. It really doesn't help in preventing what it is supposed to prevent. Also bear in mind when we talk about mask, wet mask because of your breathing or in very humid, wet environments are not going to last in preventing the virus from getting in. In fact, it'll leach out and very easily contaminate the surroundings. So make sure that it is always dry. Don't reuse the mask as often if it is already wet or has been used. Make sure that you dispose of the mask in a way that it has to be disposed, not in the normal garbage or throw away in places where other people who are unfortunately have to pick up garbage and do other things will get exposed. And once again, if they get exposed, maybe it won't affect you immediately, but then he may infect the neighbor person. And that neighbor person, when he comes to meet with you, is going to infect you back. So think of the cycle that this can create rather than just think about what we do, i.e. social responsibility. More importantly, wash your hands. And I told you one of the ways that the transmission can happen is by fecal oral route. And as specifically, this goes to people who use hands as a method of washing the back, it is important that you actually wash your hands as many times as possible, even when you touch other things. And that can actually be the most important thing that you can do for yourself. And of course, if you wash your hands, make sure that you don't touch your face. The least you want to do to get it near your nose and facilitate the virus getting into your lungs. So that kind of summarizes why you want to do all these things and how you want to create these barriers and take away some of the false notions about how this works or doesn't work. Now, what can you do further? Further, in several ways, people have posted so many different things in the internet, in the WhatsApp, and there has been a lot of junk as well as some good things that has been going around. But let me once again summarize this in very simple formats. I have put it in 5 different pillars or columns so that you can understand the 5 pillars that are important to be administered or to be adhered to so that you will be able to protect yourself effectively and prevent the transmission effectively from one person to another person. There are no specific means to increase immunity. So get away from the fact that you're going to eat this, eat that, do this, do that. It's going to boost immune boosters, whatnot. None of them have been proven clearly in the scientific way, and we do not know how much it acts. Yes, people will say, do this, and it actually will help you. And that may be something, if it is going to not affect you in any way, some vegetables, some greens, something that we normally use, and you want to take more of that, that's okay. But if you really have to take some medications, something out of the way, for which you do not know the side effects, it's best to avoid it. Use general immune enhancers, such as multivitamins. Physical exercise is perhaps the best immune enhancer, as well as very good sleep. So make sure that you're not on the WhatsApp or on the phone till late in the night, and make sure you give yourself a good rest. And this is important because that is going to be the best way to shoot up your immunity. Last but not the least, stress as a contradiction to immunity, it actually suppresses immunity. And so if you can actually be in a Zen state, or maybe keep yourself calm and peaceful and avoid stress as much as possible, that can actually make yourself, you're doing yourself a favor. Talk about foods to avoid. There is nothing in particular. All foods are good food. Everything that is cooked properly, that is good coming from nature, has to be good. However, If you're going to be relying on restaurant food or other foods that could be contaminated, filled with a lot of unhygienic practices, as well as unhygienic food, including use of a lot of not good oil or other food ingredients, as well as food additives, you should probably avoid it. So use your best, common sense to understand what they mean by foods to avoid. It is not the regular natural food that your mother cooks at home or your wife cooks at home. It is important that you understand that you want to avoid the foods that is going to be generally unhealthy. One particular aspect of nutrition, people have talked about sunlight, staying out, walking out. All those are always good because we do know that vitamin D deficiency generally decreases if you're not exposed to sunlight, if you're not out there much more than what you had once upon a time when as children we used to hang out in the sun. So this is important because a lot of us are suffering from vitamin D deficiency because we're always indoors, and that creates a significant amount of immune suppression. So in some form, if you want to prevent vitamin D deficiency, being out in the sunlight, being out, that doesn't mean that you actually go out at 5 o'clock in the evening. The only sunlight that is proven to be effective for vitamin D generation happens to be during the morning hours, not during the evening when you're partying, and then during dusk and other times when you want to hang out and have a cup of coffee or beer. Last but not the least, do yourself a favor when you stay at home. This helps both mentally as well as physically. Steam occasionally, not overdo anything, because that's going to keep your air passages as well as your respiratory pathways clean. And it is a form of yogic practice that people in our part of the neighborhood has been practicing for a very long time. These are called general nasal cleansing practices, and that can be done. Do simple breathing exercises such as pranayama or bhastrika. Once again, I'm an allopathic doctor, which means that I shouldn't be talking much about these things. However, I myself practice these things, so I thought I will be able to share it with you. Last but not the least, I told you the mental health is perhaps the most important thing because you need to avoid stress, stay peaceful, and last but not the least, be confident that you can actually get over this particular period, and this too shall pass, as our Christian brethren say. Some of the other things that you need to think about, what are the precautionary methods? We already went over it, so I'm not going to talk about it. Once again, I want to impress, and I cannot say this enough, please stay at home and be with your loved ones, because you may be ending up becoming very sick if you get exposed to COVID. There is no guarantee that it's not going to affect you. Count on it affecting you. Count on it coming to your family, but make sure that you actually protect your family. And this is your chance to spend time with your family and create good memories. So please go ahead and do that. Someone at home has been diagnosed with the COVID. How do we stop the spread? Once again, we are talking about other people, not the patient, because the patient, I'll talk about it in a little while. The best would be to get the whole family vaccinated, because that is going to prevent the serious infection being transmitted to somebody who's vulnerable in the family, like grandparents, older people, senior citizens, very young children, newborns. So you want to prevent them from getting into trouble just because you got into trouble for whatever reasons. Doesn't mean you have to wait to your family and share the problems. It's only going to compound and it's not going to help. Isolating the patient or the carrier is very important. If you are a person who's infected, you know what to do. We'll talk about it in a little while. If it's a child less than 2 years, please, please, please don't leave them with the grandparents because they don't wear barriers like masks and they don't have good hygiene. I always say, even though I take care of children as a pediatric cardiologist, I actually end up talking about infections quite a bit for various reasons. And they're all walking germ bags. If they go to school or some daycare, count on them carrying virus in their hands. Count on them bringing virus to the family and giving it to other people. So they are very good in that. So you have to be very careful when you deal with children who are young. And please make sure that they're not left or being handled by older people who need to be protected during this time. Comorbidities. This is something that comes up quite a bit. The most important thing for comorbid patients, there is no magic bullet, no treatment that is available once you get it. If you are already having a problem such as diabetes, hypertension, heart attacks, you're on medications, you have cancer, you're treated with chemotherapy or other forms of treatments that will decrease your immunity. Also, some people who have got joint problems, rheumatological problems, who are actually treated with certain medications that without your knowledge, such as steroids or other medicines that will decrease immunity, count yourself as somebody who's the most easiest for the virus to get in and create a havoc. You already have all the ingredients. All you need is a fire to actually start the cooking. And once you start cooking, it is not going to stop, okay? So that is very important for you to understand. Take it seriously and take as many precautions if you're in the vulnerable group. Two things I want to mention about the comorbidities and something that we need to think about. The most important comorbidity that has been identified in scientific journals when they looked at all the patients who died and who had serious infections abroad, including Italy and the United States, it happens to be obesity. People above a certain body surface area or BMI or weight are very, very highly vulnerable because they already have other comorbid factors such as diabetes and hypertension. Add one more layer to it. And once again, like I said, you are a sitting time bomb in order for you to get the infection as well as get into trouble and create trouble for others. So please, please do yourself a favor. So the next part of my talk is what do you do if you get some of these and how do you know whether you have the infection? Now that's going to be hard to tell. So because you do not know who you got exposed to. So if you know somebody who you got exposed to recently and happen to be diagnosed with COVID or COVID infection has been admitted to the hospital, consider yourself exposed and then get yourself tested in order for you to confirm that you're not exposed. Now, coming back to the symptoms, so you're unfortunate, you got exposed, you didn't know, you didn't do the test, but then you're landing up with the symptoms that you actually have, and you do not know what the symptoms mean. If you look at the list that I have actually put up, many of this is very common symptoms for a lot of viral infections, be it influenza, be it anything else, common cold, sore throat, respiratory infections that we commonly have, all of us go through it. But any of these symptoms could mean that you have COVID also, because you just have to assume that you have it until you do the test and prove that you don't have it. But there are certain things that are very unique to COVID itself, and that is loss of smell and taste. And if you have those, then you're very high likely that you're having a COVID infection. So in case you were exposed to someone who was COVID positive, don't wait. Like I said, take the precaution and go and get yourself tested out. So people always ask me, now once I get tested out, I'm positive. So what do I do now? Obviously, you have to be quarantined. And this is the whole functionary between how the different countries operate. When you come from a country which has got a very high COVID numbers, they presume that you have COVID infection until you can prove that there is no COVID infection. So you get quarantined. And this is for people who travel out. And this is something that I'm sure they're all aware of. But the difference between quarantine and isolation is very simple. Quarantine is suspected infection, whereas isolation is we know that you have the infection. Infection doesn't mean that you have symptoms. Infection can also mean that you only have a positive test. And if you have a positive test, it means that you really have a potential to get either a mild infection, a moderate infection, and go into a severe infection. So for the duration of 2 weeks after, 2 to 3 weeks after the positive test, it's important for you to isolate. This is used for people with confirmed or suspected COVID-19 infection to keep the person basically from infecting others. And it could either be at home or in a healthcare facility. So like I told you, this is a part of secondary prevention. And I'm going to be focusing on how to help you through this very difficult time of mild to moderate infection. I am not going to talk about severe infection because that is not something that anybody can handle at home. So I'm also going to tell you when you are slowly moving into severe infection. And at that time, it is very important that you seek yourself an admission in a hospital or a healthcare facility and then get treated appropriately. We are not going to talk about oxygen cylinders. We are not going to talk about medications that are used, which has been very hyped up and is being used in many, many newspapers and media outlets to create sensation. However, once again, like I said, the focus of this talk is to help people who are at home to contain it at home and to make sure that they do not spread and have problems while they are being isolated. So home self-quarantine instructions is a beautiful cartoon. You can see we have already talked a lot, but mostly it is the same. Keep yourself in a separate room. Make sure people do not get exposed to you. You have to use your barriers and also make the other person who's helping you or coming and supporting you with certain things also use the barriers. It's very important that you use mask, clean the utensils, keep separate utensils that is being used for people. Something that we are very, very used to doing because we have something called amme. I don't know how to say that, but it's basically something like smallpox, chickenpox, things that we already know can actually contaminate. There are times when people who had measles, chickenpox, commonpox, the houses would be basically numbered or indicated so that nobody would be coming in or going out. And this is indicated using neem leaves. We all know that. We thought it was very funny and very archaic, ancient, but certainly something that we need to remember as being something that will hold good even now. Wash hands as frequently as possible. Use a 20-second rule and make sure that you use all the 7 steps of washing your hands for a full 20 seconds. And this is very important. You do not have to do it every time. And for smaller, intermittent washing is more than adequate. Use hand sanitizer. And most importantly, when you use hand sanitizer, make sure that you're not in the cooking area because this can actually be inflammable and it can cause burns and other side effects. So be very careful. Also, usual good hygienic practices, including covering when you're coughing. Make sure you don't want to give it to another person or to your own dear ones. Wear a face mask and also make sure that the colored thing is and of course, when you are in trouble and when you are in doubt, please call or ask your doctor for further advice. The third part, the last 2 parts, of course, you're across 50% now. Treatment for mild and moderate COVID patients, be a COVID warrior. This is for people who already have the symptoms and who are already having the infection, who are sitting at home isolated. Now, once again, like I told you, I cannot impress upon this more. Stay at home, stay isolated for at least 3 weeks before things come to pass. Very importantly, if you have access to an oxygen saturation monitor, that is very, very helpful, not because you want to focus on the numbers. And this is for people who are very number oriented. It doesn't matter whether you're a 95 or a 94 or a 93. What matters is the trend. What matters is important from day to day or morning to evening. You're able to see something going down consistently. So you don't have to jump up and down. If 95 one time and 93 one time, and the next time it is 95, it's perhaps okay. Because machines tend to do that. They are not very accurate. There is so many variables that affects the oxygen saturation. One of which, for females, it's very important to understand, your nail polish can actually create a low oxygen saturation, just a trivia. However, it's important for you that you keep the trend. I'm going to show you how you want to keep the trend in the next slide. Also, check yourself by walking for about 6 minutes. It doesn't have to be, you have to go around the house in circles, but actually it can happen in the room. Time yourself for 6 minutes on your phone, and then make sure that your oxygen levels doesn't come down after you walk for 6 minutes. Also, fever that is persistent for more than 5 days or increasing breathing rates. And the way you measure the breathing rates, because you cannot do it yourself, is just place your arm on your belly or in your chest where it connects with the belly and basically see it go rising up and down and count it for a full minute. And that should tell you what your respiratory rates are. And if it is increasing, like I told you, the trend is more important. And that is important for you to remember. Maybe you're getting from mild to moderate. And of course, there are other symptoms that also to look out for. This is the monitoring chart that you would want to keep. And it is very important. It might sound very silly, like a teacher telling the student trying to get organized. But this is very important because it gives you a good idea about the trend. And like I told you, everything is about the trend. And what is important is for you to look at the trend and identify that you are much more sicker than what you were the day before, and which means that you need to seek help as soon as possible. I'm going to give you some tips. As long as your numbers are looking okay and you're stable and you're not having any serious respiratory problems or low oxygen saturations, and you're not feeling winded or breathless, all these subsequent slides will apply to you. So like I told you once again, self-isolation, good hygiene. I cannot impress on this again and again. This is a recurring theme in this talk. Why? Because it is extremely important. Barrier protection, mask, always mask. When you're alone, also mask, because you can actually accidentally have aerosols that can cripple out or get out through the windows or through the crevices of your doors and can actually infect your loved ones in your family. So also remember to wear the mask in the right way. I've already talked a bit about the mask, the do's and don'ts. Healthy diet is important during that time. Breathing exercises, I'm going to spend a few minutes on both of those. Prone breathing, I'm going to tell you how to do it and what is the best way to do it. Steam inhalation, we have talked about why it is important. It's not a treatment, but it will help you clear your secretions. It will help you make cough better and it will bring out the secretions from your lung, and hence it might be very helpful. Oxygen concentrator, everybody cannot afford it. It's an expensive unit, and it's very hard to come by when every hospital and nursing homes are wanting to buy it. If you can get a hold on it, if your saturation is lower than 94, this might help you in getting a little bit of extra help with the oxygen, and for time being, until you find a more robust way of providing oxygen to yourself, i.e., or that is the hospital. So let us talk a little bit about the food while recovering from COVID. While you're recovering, let's say you had the infection, you're doing better, and you're able to hold yourself with the tips that I had just given you, and you are a COVID warrior, then what do? You actually continue to improve on your calories, your proteins, your fruits and veggies, immune boosters. And during the time when you have the COVID, make sure you drink a lot of liquids. We are very commonly, we think only when you're thirsty, you need to drink the liquids, but it is not true. And liquids doesn't mean Pepsi and Coke or other forms of beverages. Please take healthy ones like juice. Lemon juice with a lot of citric acid is a very good thing, lemon or orange. Other forms of vegetables or fruit juices are also good, as long as you don't have any additives to it. Also remember, you can take milk or other forms of liquids, including water. I would suggest that you take at least about 2.5 to 3 liters of fluids overall, and that is very important, and that will help you urinate also better, thereby clearing a lot of unwanted material from your body. So these are some of the things that you can have for both vegetarians and non-vegetarians. But remember, not all of them we have discussed. However, you have already understood what I'm trying to impress upon when you talk about foods. Now, how are the foods important, and why are we spending a little bit of time on the type of foods that you eat? And that is because there is a scientific basis. As this cartoon tells you, it is important to take the food that will actually have a balance and is able to affect and effectively do what it is supposed to do to kill the virus or support the killing of the virus by increasing your immunity. As you can see, an anti-inflammatory effect, which is a side effect of the virus reaction to the body, which creates a lot of the unpleasant or unwanted side effects of people dying suddenly with heart attacks or clots in the brain, okay? And also lung clots, which is called pulmonary embolism. This is a good way of supporting and preventing and decreasing the inflammatory effect. Antithrombotic effect, which is basically the clotting. It prevents clot formation. And it's also the immune effects, like I told you, of the good food that we are trying to eat, which boosts the immunity. It protects against respiratory infections, so the vitamins are extremely important. And also the antioxidant effect, which prevents the effects of the inflammation on the heart, the brain, and most important, the blood vessels that supply the heart and the brain, which usually gets clotted in patients who have heart attack and strokes. So potential benefits of doing a good, healthy food intake is decreasing disease severity and also potentially preventing or decreasing, if you have to go to the hospital, the number of days you're going to be in the hospital. In summary, with regards to food, I would only say one thing. The more colorful the foods are, the better it is. I'm not talking about the color that is being put outside the foods. I'm just talking about the type of foods, whether it's a fruits or vegetables, green leafy, yellow, purple, orange, whichever you can lay your hands on, all of them are very good as immune boosters as well as vitamin supplements. So remember that, and that is extremely important. Now, a last bit about what people have been talking about. We are from the country which professes yoga, and we are the country which is also very unhealthy when it comes to exercise. So having said that, I'm going to tell you a few things about this. We have been talking about steam gargling with so many different, people have talked about salt gargle, aspirin gargle, hot water gargle, neem gargle, any number of those. Yoga, exercise, and sitting in the sun. I would summarize all of these into only one thing. As long as it doesn't have any other side effect and it's just an extension of what you've been doing normally, i.e. something that you have felt has actually provided you with a good health, continue to do it. However, all these help in general. It is not about COVID. I would go one step ahead and say, do this even without COVID, even when the COVID has gone, when we come to that time. There is no scientific data so far to support or dispute these methods for COVID because we don't have any studies coming out. COVID is still a work in progress, and we are all going through that. And we need to understand that we do not have information or answers for everything that we are seeking. And if people are able to get you answers by trying it on themselves or within 2 people or 3 people, that may not be necessarily applicable to you. That may have applied to them. And once again, that is the difference between scientific thought as well as just using whatever information that the next person is giving you. In this regard, I just wanted to lighten the discussion a little bit. If you were to do a financial decision, like putting your money in the stock market, for example, would you actually ask your neighbor who is actually not a financial person, or would you actually look at what the stock market is actually doing? So you remember, the information is only as good as where it comes from. And you need to be actually very discerning in order for you to understand whether you're getting the right information or not. The last part of the slide, I want to go over it very slowly. And please, if there is one thing that you can take away, remember this. You can do any number of these things, but the important thing is not to get carried away and have a false sense of security doing these things, because COVID is not immune to you. It will come to you. It can come to you, even if you do all these things. It might actually be lesser in severity, but it's not going to prevent you from getting the infection completely. These are some of the things that our Ministry of India has put out from the Ayurvedic standpoint. This comes from AYUSH, called Ayush. And these are their suggestions. By no means I'm endorsing it, or can I endorse it, because I do not know the studies that has been proven to show these effects. However, I do know that these are regularly used stuff in our cooking, including pudina, ajwain, clove, and honey and milk can be used as a regular treatment to make yourself feel better. As far as Chyawanprash goes, I have no idea. I can tell you a little bit about the antibiotics because there is a lot of buzz and as well as media hype that is going on regarding some of these things. And once again, without going into the depth of the politics behind it, there are no antibiotics that works against viruses. So if somebody is telling you this is going to work against it and use some sort of antibiotic, it is not correct. However, there are some antivirals that has been utilized from time to time. People have been looking at it as being effective. Some of the medications, for example, they've been talking about is ivermectin, which is used in dealing with some of the parasites. Some anti-malarial drugs have been used before, such as chloroquine, hydroxychloroquine. But the most popular that has received the most media attention, at least in India, has been remdesivir. I have seen people running from pillar to post for remdesivir. And to be very honest with you, it is really sad because it only works in a very limited window period between the time when you have a moderate infection. It is not indicated in mild infection. It doesn't work in severe infection. So you have to catch that window within a few days after you transcend from mild to moderate infection. And that's the only time it has been clearly proven to help a little bit. That too, not with mortality, but it has been clearly shown to decrease the number of days in the hospital or the number of days you have the COVID infection. It has not been proven to prevent death. There is no magic bullet or a universal medication that would work once you cross over. I wanted to talk a little bit about prone breathing. Why is it important? How does it work? And hopefully with some of the scientific picture or the cartoon that I have an explanation that might make some sense to all of you, and you may be able to practice this even going forward without the COVID, like I told you. Of course, the best breathing practices is pranayama and bastrika, and that is something that is very helpful to keep your diaphragm very strong. Diaphragm is a very important tool for breathing, and when you lose your lung, you need all the help that you can get. You're actually trying to get the last bit of your bank balance, and you better have some bank balance. And this diaphragmatic strength as well as mobility will provide the bank balance. And for that, like any other muscle in the body, you have to exercise that muscle. Okay. The other ones that people talk about as being important for the lungs works in several different ways. One important part that is very helpful for patients or people who have been infected with mild to moderate breathing, COVID infection, but have not had a decrease in oxygen saturation as yet. It is important that once you know that your symptoms are worsening, you have more fever, your breathing rates are increasing, then you probably should be doing what we call as a prone position breathing. The top part of the cartoon on the right side is very important when you normally lie down on your back, and that is called supine in medical language. When you lie down, you can see the lung has got both a top portion and a bottom portion, and also the front portion and the back portion. The blood actually travels from bottom to top, top being the one that receives the most oxygen, bottom being the one that receives the less oxygen, but it actually receives more blood when compared to the top, because blood cannot go anti-gravity. So on the other hand, when you lie down on the back, the lungs doesn't expand as well in the back. So you're not having all the parts of your lungs working for you to get the oxygen as much as possible to supply to the body. I hope you have understood that. If you have understood that, then you will understand why putting yourself on the prone position and breathing also is very, very helpful and very meaningful to treat patients who have got a little bit of breathing difficulty as well as a prolonged course of COVID. What that basically does, it reverses what I showed you in the top cartoon. You can see that the bottom portion or the back portion near the back of the body, the lungs expand very nicely. Also, because of the redistribution of the blood flow between the top and the bottom portion of the lungs, you can find more blood goes to the lungs where it receives the most oxygen. Because if you do not have the blood going to the lungs, even if you get oxygen, it is not going to translate it into the blood getting the oxygen, which means your body tissue and your brain is not getting the oxygen. So remember, your oxygen is not the oxygen that is delivered to the lungs. Your oxygen is the oxygen that actually gets transmitted from the lungs to the blood, and hence you need a good mix of both oxygen as well as blood, and hence you need to supply it to all the parts of the lungs as much as possible. And hence prone breathing is very important. And this is the best way to do the prone breathing. And this is something that I would say you have to do in cycles, and you have to do about 15 minutes of this over every hour, or if not every 2 hours. And if you do it this way and just comfortably breathe, you should be able to get enough oxygen circulating in your body and keeping your saturations well above 94. And the final part of my talk is basically vaccination. I know it has been going on for a little while with my monologue. I apologize for it. However, please try to focus on this part, because this is the bane of our existence. And this is perhaps what has resulted in the damage that we have gone through in the last wave, especially in India as well as in the US, because for various reasons, the vaccination has not reached the people to whom it has to be given. It is a way to minimize the risk. It is not going to prevent your COVID infection. So if you were to talk about vaccination, it's a single most important tool to help prevent this or to stop this pandemic. And there is multiple literature and medical literature available on this. You're more than welcome to look at a few of those. If you need further information, I will be able to provide you. Now, a little bit about the vaccines. I'm sure there are people from different areas, different backgrounds who are having access to different vaccines. But I've chosen Covaxin and Covishield because it's the most common vaccines that's used in India. Whereas in the US and in other parts of the world, you have other forms of mRNA vaccine from Pfizer and Moderna that is not completely available in India. And hence, that's not something that I would like to focus on at this time. But I'm going to talk a little bit about it after I finish with Covaxin and Covishield. So some do's and don'ts. Once again, I have mentioned whatever vaccine that you get, people have studied it and only then it has come to be used, because you need approvals from the drug authority in order for the vaccine to come into effect. However, what people have been thinking about as some vaccine killing people, that is absolutely, I wouldn't say completely untrue. However, it is not the most common thing that will happen. I'll explain to you a little bit, because that shouldn't be the reason why you do not take the vaccine, because it happens in a very, 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 very small number of patients. And that is probably unfortunate. However, could also be related to that person's body limitations or comorbidities, as we talked about. But let's focus a little bit on the do's and don'ts of these vaccines. You have to understand the Covaxin and Covishield are two different vaccines. They are not made the same way, so the effects are different, but both of them are working against, remember the spikes that I was telling you before? These vaccines work against the spike protein. The spike protein, by killing that and having some immune reaction towards it, it's able to destroy the viruses, because the membrane gets separated after the spike protein is killed, and hence the virus itself dies and it cannot multiply anymore. So if you have history of allergies or fever or bleeding disorder, you have to be very careful. And what I wanted to mention to you is, for each one of these vaccines, because it is made in different ways, it is very hard for me to summarize everything and say that these people are not supposed to be taking the vaccine. For people who have special requirements or special needs or comorbidities, like I told you, you need to consult a doctor who will actually look into that specific vaccine that you will be getting and tell you whether you can receive it or not. And this goes for the population that I just talked about and the ones that I'm seeing on the right side of the screen who should not be vaccinated. What generally people say is that severe allergy, cancer patients, severe allergy to vaccines, not to anything else. It doesn't mean if you're sneezing from the vaccine, you need to actually get that. But it means severe, I'm sorry, severe allergy to vaccines. Some cancer patients who are on chemotherapy, this is also doesn't applicable. The data is coming out that some people can get it. And if you have received the chemotherapy and you're off chemotherapy for more than a few months, you should be eligible to get the vaccine. Transplant patients who are not consistently immunosuppressed can also be receiving vaccines. However, for the general consumption, you have to be careful. Please consult the person who is going to give you the vaccines. Patients are immunosuppression medications. And last but not the least, we had previously people have been telling, and you can see in the left side of my slide, that they're pregnant females and planning pregnancy should not be taking the vaccine. I think some changes have happened in the recent past, and this is falling under the mRNA vaccine because that has been the most commonly used vaccines in the US and Italy and some parts of Europe. People have been now getting comfortable recommending it. And they in fact say it is good to give pregnant females as well as people planning pregnancy or even mothers feeding the children vaccine because it provides antibodies to go into the child and perhaps protect the child from getting the COVID infection. Now, what I wanted to tell you is a summary of the facts of a vaccine, especially the COVID vaccine. It does not completely prevent infection, but like I told you, it lessens the severity of infection and also definitely decreases mortality or death because of COVID infection. For a country to be fully vaccinated, we need about 70% of the population either being infected or vaccinated in order to be safe. And that will be the day when you can actually walk around freely without any problems. What we know for sure in some countries, and this is the data that is for fact, is available, they've been able to achieve full population vaccination target, and they are not seeing new cases, and they are now open for business. So if you want to continue your economics well, then you please take your vaccines. COVID vaccines, like flu vaccines, and this is something that we all talk about in the medical world, and be prepared, it is probably going to become a yearly affair. And like other countries which receive flu vaccines on a regular year, some countries twice a year, we are looking at COVID being vaccinated every year. In some parts of the world and in some vaccines, there has been an increased incidence of risk of clots, but this is mostly in Covishield. It has not been reported in Covaxin. and also not reported in mRNA vaccines, such as Pfizer or other forms of Moderna vaccines. The new data that has come out is sometimes when they gave mRNA vaccines that is available in the US or in some European countries, they have reported some heart inflammation or myocarditis in young adults and also teenagers after the second dose. This has not been yet reported in COVID vaccines available in India. So perhaps not a big problem. For more than 100 million doses, they've had only a handful of patients who have been reported to have this kind of heart inflammation. So please do not worry. Once again, the cost of not getting vaccinated is way too high compared to the cost of dealing with these side effects. Of course, if you have allergic reactions to the vaccines, please take extra care. One small couple of slides, we are getting to the end of the talk, other issues with COVID-19 and how to minimize the risk. The short-term effects, like I told you before, if you have COVID infection, I'm not talking about vaccine, if you have had COVID and you have come home successfully after hospitalization, you are still at a high risk to develop strokes, heart attacks, or even long-term lung changes, which people have been noticing in some studies in all the Institute of Medical Sciences. And they have found these lungs are not normal, and they have had problems with the overall pulmonary function test. So you need to get yourself monitored and take care of yourself with good practices, even if you have come back from COVID. And if you have had a COVID infection, that doesn't mean you are not going to get another infection if you have a different variant that has mutated enough. So it is important to get vaccinated. So even if you have had a COVID infection that you have survived and you're a COVID warrior, you still need to get vaccinated. One small piece regarding the fungal infection that is going around, once again, it is probably a lot to do with our man-made issues and has got nothing to do with the COVID itself. It is more related to immunosuppression because doses of steroids that has been used in different patients have been significantly different. But people say only in moderate type of COVID infection, not the mild variety, it has been shown to be some effect, and it has been clearly shown to be of effect in serious infections in preventing mortality. So when push comes to shove and your back is behind the wall, you need to actually consider steroids, no other go. But if you're going to be walking around and you're one of those mild to moderate, please be careful when you take steroids. And that can actually make you more susceptible for a different problem, and you may end up dying or even having complications related to the black fungus or mucormycosis. And once again, I wanted to reiterate, it is not because of the infection per se. The long-term effects of the COVID infections, we do not know. There is no answer. This is a work or a picture that is being evolving, and it is not clear regarding what we are going to deal with as we go forward. Precautions to take. Don't forget that there are long-term infections. Ask your doctor about continued medical treatment. If you have some of the comorbidities, or you have just had your infection and you survived, but you're still a patient who has other problems such as heart attacks and you're on medications. For certain high-risk patients, I just told you, make sure they are at a high risk for clot formation. So talk to your doctor regarding blood thinners, or you don't want to take something that is serious blood thinner, but maybe some mild blood thinners might be more than sufficient. So please consult your doctor regarding that. More importantly, when you get home, don't be in the full zeal or josh to be able to run around and do what you have been missing out in the last 2 to 3 months. That's a natural tendency, but it is very childish. So make sure that you tone down and do not overdo your physical activity, because there has been some mortality after patients have come when they've done physical activity, they've keeled over and they have died suddenly. We still do not know what the reason is, but we think it is probably because of some heart that has not completely recovered or lungs that has not completely recovered. Healthy food habits and vaccinate. So a last bit, just a side quote. We had this discussion yesterday too. In my long years of practice, I shouldn't say long, but in a few years that I've been practicing medicine, there are 3 types of patients that I've come across. And I do not know which one of you are fitting into this particular, in the audience, are fitting into this particular group. That's for you to decide. However, I will just tell you, it is in the order of difficulty. Why, as a doctor, to convey and disseminate information as well as making you understand. The easiest one to make people understand are the not informed. They have a clean slate. I can easily share information, and they're very willing to receive it. There is a group of patients who are ill-informed, who have partial information, but do not know everything. So they actually can sometimes reverse and accept some of the new information or the useful information that we provide. The worst is the misinformed. I have mentioned specifically, this has been some lingo that has gone around. It's called the idiot syndrome. It is called internet-derived information obstructing treatment. And also the so-called people who are always on WhatsApp forwarding and sending information that is not actually worthwhile, or giving wrong information, thinking that they're helping. These are the misinformed group who are very easily influenced by non-scientific data, by not people who are actually qualified to share information, but they're very taken up by every bit of sensational news or information that we get. Please avoid forwarding these things. Please avoid circulating these things. Maybe you will be helping, if not yourself, some other people who are still in the category of not informed and ill-informed. This is my pet peeve. I hope I have not offended anybody by this. So be a COVID warrior. However, the three most important things, if you didn't listen to my talk in the last hour, please remember, even Bahubali needs an armor. And this may be the future Bahubali movie that we'll be seeing with somebody with a mask on his face. So social distancing is very important. The three things that you need to remember: barrier protection, such as masks, all the time, until we can, such time that we have enough vaccination that everybody has gotten, and we have been able to prove that there is no transmission. And of course, vaccination. So please remember, this is your armor, and this is your COVID armor, and please make sure that you actually take care of yourself. So this is a long road. This is actually a true picture of Death Valley in the US. And what is more nicer in this picture, despite the long road, the empty road, you feel like you're alone, you don't have anybody to help, and a lot of things are falling apart. There is still a rising sun that is coming in the end of the road that is going to shower light and prevent darkness. So please make sure that you stop the next wave. It is in your hands. I cannot impress on this better. Do not blame anybody, because you're the one who has to take care. And if you can actually prevent it, you have done a service for yourself, your immediate loved ones, as well as the society and the surrounding neighbor. Thank you so much. I hope you guys enjoyed, as well as this would help you in the long run. Thank you.
Thank you, Dr. Sreekanth. There are a few questions. Some you have addressed already, but still I would like to take up those questions one after the other. First question from Aditi is, why is the 8th day important in a COVID patient?
There is nothing magical about the 8th day. The point, the reason they say is, if by the 8th day you have not developed, it can be 8 days or it can be 10 days. It is actually dependent on the body's reaction, and each person is very different. There is nothing magical. So remember, any population-based person will tell you, when you look at the population characteristics, just like how we come in different shapes and sizes, different heights and lengths, the response of the body and any biological organ is also very different. So it can actually be 8 days, it can be 10 days, it can be 12 days. But the idea is, generally, if you do not get into trouble by that time, you may not get into severe problem beyond that. That means your body has taken up the COVID infection in a reasonable way.
Okay, the next question is about the vaccine cocktail. She wants to know how effective, but I think what she means by a vaccine cocktail is not mixing both the vaccine and taking at the same time. Covaxin as the first shot and Covishield as the second shot. I think that's what she means by vaccine cocktail.
Okay, that cannot be done. It's a no-no. Because for two reasons. One, we do not know whether it is going to be effective. Second, we do not know how the body is going to react to different vaccines. Third, nobody has tried it. And if she's going to be somebody who will try it, then it is risky. So I suggest that we shouldn't do it. As a general recommendation, rule of thumb, do not do it. And never, ever get a different vaccine. So you cannot mix and match.
The next question is there any trick or self-help for improving the oxygen level when the SpO2 goes down?
Yes, I have already shared all those things. And once again, if I were to reiterate, make sure that you are able to actually do the breathing exercises, and you do some of your other washing techniques and clearing techniques that I shared with you earlier, and do the prone breathing. That is very important, and monitor yourself well. And during that time, take nutritious meal, and also drink adequate fluids. Those are the only things that can help. And of course, if you have fever, you need to take your fever reducing medications correctly.
Prithvi has asked two questions. One you have answered. What is the frequency you would suggest to take the steam inhalation? Then the next question is, my grandma has had an open heart surgery. She is diabetic. She is 70 plus. Is it suggested for her to get vaccinated?
I think we had enough discussion on that without belaboring the point. I think that she needs to talk to her doctor who's taking care of all her medications, because some of those can actually impact her risk with regards to the side effects of the vaccine. And hence they may want to give one vaccine, choose one vaccine over the other.
Then about the steam inhalation frequency, you said at least once in 2 hours or what?
Yes, not the steam inhalation. I was talking about the prone breathing. Yeah, steam inhalation, if you do too frequently, you'll burn your nostrils and your throat, as well as your breathing tubes. We don't want that. You do it sparingly, maybe once or twice a day is more than enough.
How many days from COVID recovery we can take a vaccine? Again, Prithvi has asked.
Generally, people say about a month after the COVID infection, you're ready to take the vaccine.
If you had seen treated various COVID patients there in Singapore, what was your experience? Can you share a few things quickly, because we are running short of time?
Yeah, well, I mean, the thing is, like I told you earlier, they have done a fantastic job in Singapore with regards to not having many COVID infections per se. They've been able to control it very well. We hardly have any patients, or rather very few patients. We do get our spikes with regards to most of them being mild and moderate, but most of them just follow the general, type that we just talked about. They go from mild, most of them mild to moderate is what the majority of them are. So most of them get better without going to severe. The ones that are actually in the hospital requiring ventilators, we do come across every once in a while those patients, and we had more before the vaccines. Now after the vaccines, that numbers have also come down significantly. That treatment is beyond the scope of this discussion because there's a lot of things that goes into it. So like I told you before, we're not talking about the severe cases, but luckily most of the cases are mild and moderate. And if you definitely have been vaccinated, you're most likely to stay in the mild category.
And Prithvi has also asked about the masks, about which you have said very clearly that using the surgical mask is the best.
Yes, as of now, from what we know.
And he has also raised about concern of Covaxin not being approved by the WHO. What is your take on that?
I think those are policy matters and how it plays into the whole politics of things. I don't think it is related to the as much as the vaccine, but I think it is more related to the fact that the data for Covaxin has not been that readily available as opposed to Covishield. Remember, even for Covishield, even though India is a major producer of Covishield from the Serum Institute, it is still not the major producer of data. The data for Covishield has mostly come from the UK and rest of the European countries. So I think part of the reason we have not been very good in generating the data to support what these vaccines can do, and that has been the problem with regards to our vaccines getting approved quickly by the WHO. However, it has been approved by the drug organization called DGCA in India, and hopefully they have some data that they can share or supply in case there are some questions about Covaxin.
Thank you. And one last question. This is from one Parthasarathi. He says, this is about the mRNA vaccines in the US. For those who missed the second dose or beyond the recommended interval, is it necessary to repeat the dose? Meaning, I think he's asking whether you have to take the first dose and again after the 6th or the 8th week, then has to take the second dose. Is that necessary? Or if if it goes beyond, say, 8 weeks after the first dose, still the second dose will work?
Okay, it's a very good question. It's an excellent question, by the way. And this perhaps will apply not just to the mRNA vaccines in the US or in Europe, but can also apply to our local vaccines. What is being said so far that we know for sure, remember, we'll take the example of the AstraZeneca vaccine, which is not available in the US. I'll come to the US a little bit later. Initially, they said they will give it for 3 weeks or 4 weeks, the second dose. And then they said we can stretch it up to 3 months also. The later we give it, it's going to actually, they found out that it actually enhances immunity better. The same applied to our Covishield vaccine, because it's the same AstraZeneca vaccine that has been prepared in the UK and shared with the Serum Institute for preparation. The similar data is not available for Covaxin, and hence I don't know whether we can extrapolate this. In answering your question for the people in India, yes, however late it is, please go ahead and take the second dose of vaccine, because we do know that the first dose is actually producing some efficacy. It's able to generate antibodies by the time they're about a month or 2 months old, and it's able to give you about 70% protection, or varying between 60% to 70% protection. If you need better protection, better response to the infection if and when you get it, and also varying mutants of the infection per se, then having the second dose will come in very handy, because nobody has studied whether one dose is adequate. And we also do not know whether one dose will prevent the other variants. Because remember, as the mutations happen, the efficacy of the vaccine will also come down. The same applies to mRNA vaccine, but we have more data on mRNA vaccine from the US and Europe. And what it basically says is that even if it is late, and in some areas they have extended the mRNA vaccine also to about 2 to 3 months. In places where the vaccine is readily available, they're giving it within 1 month, but you can take it in 2 months and 3 months also. So if you have missed out, and you're within that period, past the 1 month period, it doesn't matter. Please go ahead and take the next vaccine.
Thank you so much, Dr. Sreekanth, and thanks for the participants for participating and also being interactive by throwing some very relevant questions. Thanks again, and we are planning for a couple of more sessions in Tamil and other languages. So see you soon. Thanks once again to Jayakumar for facilitating the online.
Thank you, sir.
Thank you so much.
Thank you, Dr. Sreekanth, and appreciate for taking your time on a Sunday, it's late evening, and